Patients who exhibit equinus gait are often seen walking on their toes as shown. This type of gait is a result of having weak ankle dorsiflexors, most notably the tibialis anterior. By not being able to lift the foot during swing, the patient remains in a state of plantar flexion throughout the gait cycle. Thus, they have a characteristic toe walk.
Foot slap is commonly seen in patients who use lower limb prosthetics. A sudden drop of the foot upon the beginning of the stance phase characterizes this gait. Like the equinus gait, foot slap results from having weak dorsiflexors. A typical test for determining whether one has Trendelenburg gait is to ask the patient to lift one leg in the air. If they are able to keep their pelvis level while doing so, as shown in the video, then they do not exhibit Trendelenburg gait. However, if the patient's pelvis drops while attempting to lift their leg, then they have tested positive for weak hip abductors. Trendelenburg gait arises from having weak hip abductors, specifically the gluteus medius and gluteus minimus. Patients with this condition cannot stabilize their pelvis during the stance phase, and their contralateral side of the pelvis drops as a result. A characteristic leaning of the trunk and outward swing of the leg is seen with patients who have this condition.
Patients who have weak quadriceps tend to lean over the hip during stance phase. This causes the center of gravity to be shifted forward so that the line of force will remain anterior to the knee. As a result, the knee remains in a state of extension throughout stance.
Those who have weak hip extensors exhibit a backward lean of the trunk early in stance. This acts to shift the line of gravity posterior to the hip and reduces the work needed to be done by the hip extensors, such as the gluteus maximus.